Hello, everyone, and welcome. As future doctors, interpreting an abdominal x-ray is one of those skills you're going to use all the time, day in and day out on the wards. It's absolutely fundamental, so let's get you feeling really confident with it. Okay, let's not waste any time. We'll jump straight in with a case. So imagine this. A patient comes into your casualty department. They've got severe colicky abdominal pain, and they're vomiting. You get an abdominal film, and this is what you see. Just take a second. What's going through your mind? What's the first thing that catches your eye? If you were thinking small bowel obstruction, then you are absolutely right. Well done. You see those classic step-ladder air fluid levels? That's the big giveaway. So today, our whole goal is to systematically break down how you can spot this and a few other critical findings that you just cannot afford to miss. So here's our plan for today. We'll start with obstructions, then we'll move on to signs of inflammation, talk about the dangers of seeing air where it shouldn't be, and finally, we'll cover some very critical signs that you must know. All right, let's begin. Section 1, obstructions. This is really your bread and butter in acute medicine and surgery, so let's learn how to confidently tell them apart on a simple x-ray. Now, what's really useful here is this comparison. For a small bowel obstruction, we have the supine film on the left and the upright film on the right. In the supine view, sure, you can see multiple dilated loops of small bowel. But look at the upright film. That's where the diagnosis just pops out at you. You see those beautiful multiple air fluid levels? That's what makes it obvious. And here we have another classic sign. This is called the string of pearls. Just look closely. Can you see how those small pockets of air get trapped between the mucosal folds, the valvulae conniventes, in a bowel that's mostly filled with fluid? It looks just like a string of beads. If you see this pattern, SBO has to be at the very top of your list. This is a favorite exam question and, more importantly, a crucial clinical sign. Okay, so we've moved from the small bowel. Now let's talk about the large bowel. Here we're talking about volvulus. That's a twisting of the bowel on itself. And let me tell you, this is a true surgical emergency. It's absolutely vital that you can tell the difference between a sigmoid volvulus, which is the more common one, and the much rarer cecal volvulus. And here is another one of those classic signs you have to burn into your brain, the coffee bean sign. This massively dilated loop of the sigmoid colon looks exactly like a giant coffee bean. When you see this, it's pretty much pathognomonic for a sigmoid volvulus. This side-by-side view is just excellent for comparison. On the left, you see that huge coffee bean of the sigmoid volvulus with no haustral markings. Compare that to the right. The cecal volvulus often looks more like a kidney, or some people say a fetal shape. Recognizing the specific shape and the location is absolutely key to getting the diagnosis right. Okay then, we've talked about obstruction. Let's switch gears a bit and focus on inflammation. You see, sometimes the clues aren't in the gas pattern, but they're hidden in the bowel wall itself. Now this sign is called thumbprinting, and you can see why, can't you? It really looks like someone has pushed their thumb into the side of the bowel wall, creating these indentations. What's causing this? It's significant swelling, or edema, of the haustra. So here's the important part. When you see thumbprinting, your mind has to immediately jump to a differential diagnosis. Could this be inflammatory bowel disease, or maybe an infection like C. diff? Or could it be something even more sinister, like ischemic colitis? This sign is telling you that the bowel is very, very sick. Right. Now for a topic that is of the utmost importance: air. Normally, gas is inside the bowel. That's fine. But the moment you see air outside the bowel, floating freely in the abdominal cavity, you are dealing with a surgical emergency. No exceptions. The proper medical term for this is pneumoperitoneum. Let's break it down. Pneumo for air, peritoneum for the abdominal cavity. And in almost every single case, this means only one thing. There is a hole in the bowel. It is perforated. So why does the bowel perforate? Well, this slide shows you the usual suspects. It might be a perforated peptic ulcer, a nasty complication of appendicitis or diverticulitis, or even penetrating trauma. The reason might change, but the result? Free air is always a massive red flag. And this image shows you brilliantly the best way to find it. You must get an erect chest x-ray. Why? Because air rises, and you will see this beautiful, thin crescent of black air just underneath the diaphragm. If you see this, you pick up the phone and you call the surgical registrar immediately. This is a finding you can never, ever, ever miss. Lastly, let's cover a few more signs. Now, these can be a bit more subtle, but they are incredibly important and they're all related to air being in places it has no business being. Spotting these findings is what separates a good doctor from a great one. First up, we have pneumatosis intestinalis. Now, this isn't free air in the abdomen. This is air that has somehow gotten into the wall of the bowel itself. This is a very, very ominous sign. It often means that the bowel tissue is dying from a lack of blood supply, what we call ischemia. Look very closely at this film. Can you see those dark, linear streaks of air that are tracing the actual contour of the bowel wall? That is pneumatosis, and this tells you the bowel is ischemic, maybe even necrotic. The mortality rate when you see this sign is extremely high. And two other critical findings to have on your radar are pneumobilia, which is air in the biliary system, and portal venous gas. Seeing gas in the portal vein, which you'll spot branching out towards the edge of the liver, is a truly grave sign. It suggests widespread bowel necrosis and unfortunately carries a dismal prognosis. Okay, to finish up, let's put your new skills to the test. You're on call overnight. This is the film of a very sick patient. I want you to take a close look. What is the critical, life-threatening sign that is visible on this X-ray? The answer is pneumatosis intestinalis. Did you manage to spot those subtle linear lucencies in the bowel wall? It is this ability to spot these subtle but deadly signs that will save lives and make you a truly excellent clinician. So please, keep looking at films, keep asking questions, and keep learning. You've done very well today.